Hi everyone, so my name is Sarah Blomeier and the topic I will be discussing today is dementia. Dementia is a topic that is very close to my heart. I have been working in long-term nursing for over 7 years now, specifically with Alzheimer's and dementia patients and those affected with their memory. Um, so every day I get to work with these residents and I get to see firsthand how this disease affects not only the resident but their families and friends too. Um, According to the Alzheimer's Association, dementia kills more people every year than prostate and breast cancer combined, which was a pretty interesting fact that stuck out to me. Um, and also, dementia is often mistaken as just Alzheimer's. When people talk about, people who are affected by memory problems, everybody just automatically assumes that it's Alzheimer's. But dementia is actually the big umbrella term, and Alzheimer's is a type of dementia, along with some others. And the other types of dementia are Alzheimer's, which is the most common, and there's also vascular, Lewy body, frontotemporal, Huntington's, and mixed dementia, which is from more than one cause. Some of the signs and symptoms, dementia symptoms usually start off pretty slow and they progress over time. Some of the first signs that people recognize are when their loved ones start forgetting to pay their bills or forgetting some of their doctor's appointments or going out to the grocery store and forgetting how to get back home or forgetting how to get from point A to point B. And just changes in general in their short-term memory. And when having conversations with people, you may often hear them repeat themselves, or they may respond inappropriately to some questions. So those are some of the early warning signs of dementia. The cause of dementia, it can be caused by various diseases that harm the brain cells. This damage disrupts communication between the cells, which ultimately affect the thinking, behavior, and emotions. Different types of dementia are linked to specific types of brain cell damage in specific regions of the brain. For example, Alzheimer's is associated with high levels of certain proteins, which makes it difficult for the brain cells to communicate and stay healthy. So as a result, the brain regions responsible for functions like memory, judgment, and movement are affected, which present the signs and symptoms of dementia. For the diagnostic testing, currently there is no testing that can be done to diagnose dementia. Doctors can use things such as previous family medical history, physical exams, laboratory testing, those things to determine if a person has dementia. But to get a specific diagnosis of what kind of dementia they may have, the doctor may refer them to a specialist such as a neurologist, a psychiatrist, or a geriatrician, and they can do some further testing to see what the specific type of dementia is. As far as treatment, there is no cure for dementia, sadly, but there are medications that are often used to help treat the symptoms, and some of the common medications are things like Aricept and Namenda. Some non-drug approaches are to just simply accept the fact that the person has dementia. They're not just trying to give you a hard time. Oftentimes I see family members that are in denial that their loved one has dementia, but they're just suffering from the disease. They're not intentionally trying to give somebody or their caregiver a hard time. Behaviors from them are often triggered by unmet needs, things like needing to go to the bathroom or being in pain or being hungry. A lot of the times it's hard for somebody with dementia to verbalize those needs that they have, which can lead to them having unwanted behaviors. Diet at home. According to the Alzheimer's Association, evidence suggests that eating a heart-healthy diet may help to protect the brain. A heart-healthy diet means eating plenty of fish, or fresh fruit, vegetables, lean proteins like fish, chicken, and things like that, low-fat dairy, and limiting the amounts of sugar and saturated fat intake. Regular exercise is also important in maintaining healthy heart function. Also, to as you get older, keeping your brain active is also very important. So doing things like puzzles, crafts, games, anything that's going to keep your mind busy is also very important. The prognosis, so the life expectancy of someone with dementia is just based on the type that they have. Alzheimer's, which is the most common, is typically 8 to 10 years, but that's just, a range of years. It can be shorter or longer than that. Vascular dementia is around 5 years, and that's because they're more likely to suffer from a heart attack or stroke. And Lewy body is about 6 years, and frontotemporal is about 6 to 8 years.